On today's edition of Your Life Redefined, it's a non-invasive, innovative therapy that has been providing relief in Europe for well over a decade. We're taking an in-depth look at radial pulse therapy and how it's having some shocking results here in the States.
My name's Craig Davis, and I'm the shortest, fastest, oldest white guy.
Also, Craig Davis went from working behind the desk to being a world-ranked sprinter. He shares some secrets on how to get back to your favorite sport. All this and more on today's edition of Your Life Redefined. Hi, and welcome to Your Life Redefined. I'm your host, Dr. Anna Marie. We're on location today in Boca Raton, Florida, taking a look at a new innovative tool in the art of medicine. And as you'll see in our first story, it's causing quite a shockwave.
It's a little magic tool, for sure.
It took the healing to a completely new level.
That was my salvation.
The body parts may be different, the conditions they battled may be different, but the therapy that helped these three individuals find relief came from this one device. What we're talking about is radial pulse shockwave therapy, a therapy that carries some interesting nicknames.
Some people call it the jackhammer, which is one of my favorites, and some people call it the meat tenderizer, which sounds kind of scary, so we stay away from that name.
Dr. Todd Rodman is a chiropractor who specializes in non-surgical sports medicine. Being a self-proclaimed gadget nerd, Dr. Rodman was first exposed to the radial pulse shockwave therapy while on staff with the Ironman triathlon. He was so impressed with the priceless $20,000 device, he wanted to offer it to his patients in his office setting.
I'm always looking for another tool in my toolbox, something that may help a patient, as best and as quickly as possible. It reaches muscles deeper than my hands can in a quicker, shorter period of time, and it's very efficient and it's not painful for the patient. It's getting people back to what they love to do in sometimes 2-3 visits as opposed to 10-20, and it's been amazing for my practice.
So amazing that the device is attracting patients from out of the country, drawing them to Dr. Rodman's practice in Boca Raton, Florida.
She's been having neck pain, shoulder pain into both arms.
Migdalia Hernandez was so desperate to find her mother pain relief, she just flew her in from Puerto Rico. She actually found Dr. Todd online.
I was looking for this type of treatment. I went to a blog. I see his name in it, and I click on it and say, boy, he does it to the entire body, so I'm gonna give them a call. I spent $1 million just to don't see her crying. It's just, I get emotional.
She did amazing. Smile on her face when she left. She felt a huge relief in pain, which was great subjectively, her telling me she felt better, but objectively measuring, her neck range of motion increased by about 30% in extension, which was painful. And when she did this before, she would get pain into her shoulders. A lot of it was just from working on the muscles around there. And also her arms, her shoulder range of motion improved significantly too, so she was very happy leaving.
Physical therapist David Lippitz from Long Island, New York, has treated more than 200 patients with this innovative device.
The unit has had a tremendous effect on our practice. The first thing, obviously, is it enables a patient to get better sooner and quicker. The second thing is it enables us as therapists to deliver something to the patient that wasn't physically possible prior. Essentially what we were doing prior to this was utilizing our hands to try and manipulate tissue. It's far more effective to utilize a device like the radial shockwave therapy, and it also takes a lot of stress out of us as clinicians. So overall, it's been a win-win for everybody.
Well, I am 73 years old, but inside, in my mind and my body, I feel like a 50-year-old person. And that precisely maybe the reason why my chronic pains was so hard for me.
Jaime Piescachon gets emotional just thinking how the radial pulse shockwave therapy gave him his quality of life back. After exhausting 2 back surgeries and even after having a spinal cord pain stimulator implanted into his back, Jaime's life was still crippled by chronic pain.
My 2 main doctors that I visited for my back, my surgeon and the pain management doctor, they had told me, sorry, there is nothing that we can do. This is a chronic pain and you will have to live for the rest of your life. The chronic pain didn't allow me to sit down for more than 15 minutes because the burning was horrible. The chronic pain didn't allow me to lay on my back in bed to read a book. Right now, I can sit longer times with no pain whatsoever. I can lay back on my in bed, read my books. At this point in time, I can say that I have recovered my quality of life, and I am at least 80% better thanks to this treatment.
He's had a lot of failed back surgeries. Even though back surgery can be great, his didn't work out. And the therapies that I was doing, the active release technique, the Graston technique, movement taping, chiropractic adjustments, just weren't quite getting at the root of it. No matter how hard I tried, I couldn't quite get deep enough. If you imagine a muscle being like a rubber band and it stretches and it contracts. Now if you imagine putting super glue on a part of that rubber band, that area just won't move very well. So really the problem that plagues today's society is overuse injuries. It's not that major trauma. That's not how things always happen. But that is how we develop these scars on these muscles, and it limits our range of motion. It can adhere to nerves that course through the muscle, and every time you use that muscle, now it's going to pull on that nerve. So a lot of radiating type pain or nerve pain is actually from scar tissue that adheres to a nerve. I've studied a lot of techniques to kind of pinpoint and really try to get that scar tissue out. Graston technique has been great for it at really removing the scar tissue superficially. Active release technique is a little bit deeper, but nothing that I have done so far has been as profound or as significant as shockwave therapy, which really tremendously breaks up scar tissue in the shortest amount of time that I've ever seen before, and also saves my hands.
So in a sense, the radial pulse therapy, which is cleared by the FDA for the treatment of muscle aches and pains and for increasing circulation, is an extension of the practitioner or therapist's hands. Jeff Gebhardt treated patients for many years as an athletic trainer.
You start to develop wear and tear in your hands. You develop maybe arthritis or just other type of conditions, whether it's carpal tunnel or something like that. You abuse your body as a physical therapist, a chiropractor, athletic trainer. Radial shockwave or radial pulse therapy is a good analogy. It's a ballistic shock or a ballistic energy delivered to the tissue, and it's like dropping a rock in a pond. So that at the point of impact you have the most energy, and it has a ripple effect outside of that impact point. Whereas traditionally shockwave is thought of as like for lithotripsy, used to break up kidney stones into the kidney, and it's like taking a rifle and trying to hit a bullseye, which would be the kidney stone. So this is a very generic or very general, more superficial treatment.
I thought, if the Olympic athletes are using this, then, this must be something worth doing.
Marathon runner Gail Valcho credits the radial pulse therapy or radial shockwave for swiftly relieving her Achilles tendon pain in her left leg. Matter of fact, at the age of 48, Gail is right now training for her first triathlon.
I just want to keep doing everything that I love to do as long as I possibly can.
It's mindset.
3, 2, 1, go!
Mindset plays an integral role when it comes to physical performance. Ask Larry Schnurmacher.
One more. Let's go. Come on. Good job, Larry. 5 rounds done, buddy.
At the age of 47, Larry is in the midst of intensive training for an upcoming CrossFit competition. He recently turned to Dr. Todd Rodman and his new radial shockwave device to help ease some pain he was experiencing in his forearms.
Within 2-3 treatments of my forearm, all sorts of minor pain from picking up a cup to shaving to tucking my shirt in my pants stopped completely. No more little tweaking pain.
We've had people that were cured really in one visit. We've had some people that, you know, it's 10 visits now, and they're 80, 90% better, but they like the machine and they want to strive to really get to 100% or as close as they possibly can be to 100%, which may never, you know, honestly be achievable with certain conditions, but they can get 95% and they don't think about their pain anymore and they're back to their activities of daily living and they don't have to have that first thought of their day, how bad is this pain going to be today?
Coming up next on Your Life Redefined.
Do you think it works?
Absolutely. It's a proven fact.
Craig Davis went from being a desk jockey to being a world-ranked sprinter. When we come back, Craig shares with us why he turned to the revolutionary radial pulse therapy. Stay tuned. Your Life Redefined. We'll be right back. Hi, and welcome back to Your Life Redefined. If you're just joining us, we're taking a look at shockwave therapy and how it's helping some folks with chronic pain get back their quality of life.
Just listen to the gun to go off, and you go.
He went from being a desk jockey to being a world-class sprinter. Meet Craig Davis.
My name's Craig Davis, and I'm the shortest, fastest, oldest white guy. And I'm world ranked in 100 meter, 200 meter, and 400 meter dash at the age of 55, almost 56 years of age.
Craig started running track back in 4th grade and continued all the way through college. Then, like for many people, marriage, family, and career took priority.
Once college, you know, finished up, I got married and having children, and 25 years went by, and next thing you know, I was talking with a massage therapist, and she said, "You ran track, so why aren't you running, you know, in the Florida Sunshine State Games?" And I went, "Well, I don't know, where are they?" And he said, "It's right down the street in the next 6 weeks." And that's how I got started back in 2005. Trying to warm up here. Don't want to pull any more hamstrings here. My health became better, and basically converting that office style of a body back into an athlete, it took a number of years for it to really gel, and next thing you know, I'm the shortest, fastest, oldest white guy and world-ranked sprinter.
So it's a big race tomorrow?
Yeah, we're doing a 100 meter, 200 meter dash down at the University of Miami. A little different though, running against the college kids.
We met up with Craig during one of his recent treatment sessions with Dr. Todd Rodman. Craig credits this innovative radial pulse therapy, or shockwave therapy, for keeping him on track when it comes to his sprinting performance.
Do you think it works?
Absolutely. It's a proven fact. You don't go and have a pulled hamstring and go out and compete against some of the fastest people in Florida and still win the gold medal in that event without having something done to you to help you heal.
Chronic injuries don't heal very well, so it needs to have that inflammatory response triggered. So we create a small tissue trauma, a small tissue insult to help stimulate that healing process of something that has kind of lost the battle and walled off the area with this dense, thick scar tissue. So by hitting it so many times, it really tenderizes it or softens up the muscle, but also at the same time, it's bringing a lot of blood flow to the area to stimulate the healing response in a controlled way to help it to re-heal, which is truly amazing.
The sad story is, this 55-year-old world-ranked master sprinter injured his hamstring muscle right before flying out to film this popular Japanese reality show.
2 days before my Japanese reality TV show on November 17th, I pulled my hamstring and I knew I couldn't get in to see Dr. Rodman for the shockwave treatments. I know how to run with an injured hamstring. You're basically running on your quad and not overextending. So unfortunately, I had to take little short choppy steps. I flew back 2 days later and immediately got in, and he did the shockwave treatments on me every other day for the next 3 weeks. And I was able to, compete very well in the Florida Senior Games December 9th. And I finished first in the 100, the 200, and 400 meters.
So tell us about the Japanese TV show that you were on. Were you faster than an 11-year-old Japanese kid?
Yes, we were. Now, unfortunately, I wasn't quite as fast as I wanted to because I actually pulled my hamstring.
From running in the World's Championship in Brazil to a Masters event in Turin, Italy, these are a couple items on Craig's track and field bucket list. But when it comes right down to it, he's one ageless athlete that's passionate about living an active life.
No, I'm not slowing down one. If you look at the scale, though, as you do get older, yes, you do slow down. So unfortunately, the fast twitch muscles, do succumb to, that age thing. But I will try to keep it as fast as I possibly can. I think that a person that's active has a better life. And I look at my grandkids and I just go, I want to be still playing with those kids. As a matter of fact, I may want to help them run track and field someday. So for me, I want to stay active. And as far as those little thoughts coming in your head, why would I not do this? I like the alternative.
I want to thank Dr. Rodman and his staff, and of course all of his wonderful patients, for sharing their stories with us. We wish them the very best. For more information about the story, be sure to check out our show's website at rl.tv. We'll be right back. Coming up next on Your Life Redefined, Craig Davis shares with us some tips for getting back into shape. Stay tuned. Your Life Redefined. We'll be right back. Since I have the shortest, fastest, oldest
white guy.
Okay.
I know.
I get to wear shin splints when I run.
Right?
And you have some good tips for me.
Oh, absolutely. So what you want to do, about maybe 10 meters, and we can just go to the fire plug and back.
Okay.
All you got to do is raise up on your toes
Okay.
and just walk on your toes and then try to stay tall.
Now, since we had the world-ranked master sprinter Craig Davis with us for the day, thought we'd get him to share some of his tips. His website, shortest-fastest-oldest-white-guy-I-know.com, is full of helpful advice when it comes to getting back to your favorite sport.
On my website, I say I went from a desk jockey to a world-class sprinter. And when you're a sedentary person all day long, it's a little different, coming out and being competitive. So I would advise anybody that you got to take your time. You got to, think about it as a baby. You crawl, you walk, you stumble, you fall, you get up, and eventually you can run. And next thing you know, you're doing things that you want to be doing. What I found and what caused me to rethink, because when you're 48 years old, and then by the second or third week, I thought I was ready to go again. But you start thinking that you're 20 years old, and next thing, I pulled a hamstring. My very first time running again, because I felt the body was ready, but you need to take a much longer time getting prepared because your muscles aren't accustomed to, I would say, the strength that it takes to run, at least in sprinting, compared to, jogging and, kind of getting ready to do a long distance marathon. You can, slowly get in there without as many injuries compared to sprinting. I think once you understand how the body functions, you also have to understand what you have to do to maintain a very flexible body and one that won't injure itself. All you got to do is get off the couch once. And don't do too much, too fast, too soon, because you hurt yourself. And that's what I did for the first few years. I go out there, I thought I was 20 years old again. Either weekend warrior kind of mentality where I'm gonna go out there like I was when I was 20, 25, 18, whatever the age, you're not that age anymore. You have to take it a little slower. And I actually today, someone finally told me, Craig, the way I practice is at 85%. I was out there trying to get faster, get faster, get faster. So practicing at 85%, I'm getting stronger because I have the speed, the strength is there, you build the muscle strength. And that's the same thing, anybody just getting out off the couch. You gotta build your muscle strength before you start doing too much.
Any words of encouragement to get them motivated to be active or get back to a childhood passion?
You gotta, it's just like anything in life. If you look at you're looking for a plan, you're planning your trip, you're planning a vacation. You gotta plan out your life. You gotta plan out your physical life, your emotional life, it's all a balance. And if you can find a balance in anything that you do, I think the activity that you need just to have good health is to have activity. It is a process, life's a process. So why not bring back that passion that you had and get off the couch and work at it. But work at it slowly so you don't injure yourself. And again, don't do it at 100%. You know, do the 50, 60, 70%, 80%, and eventually you'll be well.
Coming up next on Your Life Redefined, what every pet owner needs to know about bones and your dog's health. Your Life Redefined will be right back. It's now time for some trivia. What percentage of women and men over 50 are likely to break a bone at some point in their lifetime because of osteoporosis? The answer when we come back. Did you figure out our trivia question? Well, the answer is A. Osteoporosis is responsible for bone fractures in 1 out of every 2 women over 50 and 1 out of every 4 men over 50. Hip, spine, and wrist fractures are common because those areas are most susceptible to bone loss. Hi, and welcome back to Your Life Redefined. If you're a dog lover like me, sometimes you get tempted to give your dog a bone. Well, as you'll see in our tail end segment, maybe that bone is just not worth it. Dogs love to chew, and letting them chew away on big old bones seems to be natural, but you should know there's a very real risk of problems with these treats. Even the FDA has sent out consumer alerts about this practice. Chewing on bones, especially these large cow bones sold in many pet stores, leads to a very unusual wear of the enamel on the teeth and even fractured or cracked teeth. Not only is this painful, but a broken tooth will eventually lead to a root canal or an extraction, both costly procedures and often done by a veterinary dentist. Bones can also cause a blockage in the digestive tract in almost any spot. Common locations are the esophagus and the stomach and all spots of the intestinal tract. These blockages require emergency surgery and several days of hospitalization, all costly and preventable. And cooked bones are not any better. They have the potential to splinter, and these shards could go through the digestive tract or even lacerate the mouth, tongue, or other delicate structures. A perforation through the stomach or intestine can set up a potential deadly case of peritonitis and an expensive trip to the animal ER. All of this is true for beef or poultry bones. None are 100% safe. People who recommend a raw food diet and the so-called experts on the internet will try to persuade you that bones are not dangerous and actually provide some benefits. Best advice, talk to your own vet about the real risks about feeding bones. They likely have seen some very bad cases and know how serious the risks truly are. After that discussion, ask yourself, are you willing to gamble your pet's health on something your pet really doesn't need? There's just way too many healthy treats out there, so talk to your veterinarian to see what's right for your pet. Well, that's all the time we have left. Until next time, remember, it's your life, live it, and live it well. We'll see you next time. For more information about Your Life Redefined, check out our show's website at rl.tv.
Same thing. If you toe out now, you're kind of hitting all angles of those muscles, and which also should strengthen up the area around that, your area where you get the shin splints.
Are you ready?
Ready. Set, go. Great. I didn't expect you to do that, but I went with it.